Hi, my name is Tweeman Tran, and I will be talking about aging, its effects, and certain coping methods that could help the aging process. I will start off with talking about the cognitive effects of aging. The main cognitive effects of aging would definitely have to be the decline in memory. Episodic memory is the memory of autobiographical events. This is a recall of personal facts. Examples of this would definitely have to be remembering the first day of school, remembering the best vacation you went on with your family, or even remembering where you were when you learned certain stuff. This usually starts declining in the Middle Ages. Semantic memory is a memory of knowledgeable concepts, ideas, or facts. This is the recall of general facts. Examples of this would have to be knowing your ABCs, remembering that 10 millimeters equals 1 centimeter, or the equation to a certain math problem. Also, when people start declining in their semantic memory, it usually causes trouble for them and they become more dependable on others to do certain tasks for them because they lose their ability to use certain strategies to get those tasks done. Side note, the more active you are and the more you participate in activities, whether it's inside or outside, the slower the rate at which the brain ages is. Abnormal aging effects. Normal aging is bound to happen. Everyone is going to get old. Everyone is going to age. It is just meant to be, and it's going to happen. With normal aging, functions are completed at a slower rate. However, the cognitive skills still remain stable, so they can still get things done, but it will take a little bit longer because they'll be a little bit slower. MCI, which is short for mild cognitive impairment, this is when the person has issues with memory. The problems that come with MCI are severe enough so that people recognize it. However, it is not too severe to the point where it hinders them from completing certain tasks. Dementia, on the other hand, this is when they have issues with memory and daily functions. This is the permanent and progressive loss of cognitive functions such as thinking, reasoning, or even remembering, and this is due to brain damage. After the first set of symptoms or problems kick in, they usually have 8 to 10 years to live. In the early stage of dementia, there are bits of memory loss, so the people who are going through this stage usually feel embarrassed or emotional because they know that they are slowly losing their memory. In the middle stage, this is when they have difficulty communicating and saying certain words. They have difficult time recognizing familiar faces, familiar people, or familiar things such as their family members or something that they grew up with. And this is when they have a hard time just doing certain tasks and they behave in a challenging manner. They begin the incontinence. In the late stage is when they eventually become fully bedridden. They lose their ability to move around on their own or do certain things on their own. And this is also when they are no longer able to smile, swallow, or even speak. And this is also when they become totally incontinent of urine, feces, so they can't go to the bathroom on their own, and that all eventually leads to death. 5 stages of grief, which is also known as Kubler-Ross model. This could be defined as stages of grief that Dr. Kubler-Ross, who was a psychiatrist, put together after asking her terminally ill patients how they felt as their final day drew closer. This is also referred to as DAPDA, D for denial, A for anger, B for bargaining, D for depression, and A for acceptance. Denial is the first stage, and this usually happens when the person refuses to accept their diagnosis. They think that a mistake has occurred. This usually lasts for a few minutes, and for example, in the doctor's office, or even until death. Anger is the second stage. This is when they realize that death is their actual finish, that they are angry for not seeking help earlier, or they are even angry for living a bad lifestyle that put them in this situation. Some people might express their anger and some might hold it in. Bargaining is the third stage. This is typically done privately, but not always. This is when the person makes a deal with a higher being such as God or a healthcare provider, theirs maybe, and a person who has a goal in this stage to live a little bit longer, it usually helps prolong their life a few months. Depression is the fourth stage. This is when they realize that death is their ultimate ending, and they are upset about the unaccomplished goals. They are upset about the things they've done and they regret. So this is basically when all the negative thoughts start coming in, and this is when they keep to themselves, or some even more publicly. Fifth stage is acceptance. This occurs when the patient just comes to terms with what is going to happen and they are okay with it. This is also when they start helping their family members or their loved ones also accept their death. Side note, some people skip certain stages. Some people go through the stages quickly and accept their death early on, and some go through the 5 stages, then relapse and experience the beginning stages again. Coping methods. Elder to loved ones. Definitely communicate. They can't cope with something if they don't know what is happening. Loved ones to elder. Listen to them. Communication is key, but also listening. Be a great listener and don't tell them that they are wrong for feeling what they feel. Don't tell someone to cheer up if they're sad. Individually, elder and loved ones, don't be afraid to ask for help or support. You gotta respect yourself emotionally and mentally, and going to something like this could definitely be hard. So asking for help and support is a good way to go. And also know that it is okay and completely acceptable to cry and to want to be alone. This is not a sign of weakness. It is, just a way of coping. And to feel that way, it is completely normal. So it's fine. My reason of choice of topic, for this choice of topic and its future purpose, I chose this topic because I witnessed the effects of aging firsthand while at clinicals. I am working on getting my BSN so that I could get my MSN, then my DNP. Even though I am striving to get my DNP degree, I ultimately want to work as geriatric nurse and care for the elderly. Or if I don't work as that, then I would love to work under hospice. Before going to clinicals, I didn't know much about the effects of aging other than what was given throughout the textbook and what was provided by the textbook. But I didn't know how it looked, quote unquote, looked in person. With this information, I will be able to apply my knowledge into my actions to provide better care when I go back to complete more clinical hours or even work in a hospital. With a handful of information that I stumbled upon doing this project, I will be able to work better under pressure and help my patients and their loved ones cope with the aging process. As for my personal life, I can use my gained knowledge to create a less stressful environment for my grandparents, which would definitely have to be my first priority if I were to take care of them right now. I feel like it would definitely benefit me and anyone else who has to take care of an elderly to know about the basics of the aging process and how to help everyone cope with it, whether it is the elderly person or their loved one. I think it is just important to know, and it doesn't hurt to learn about the extra information. And these are my works cited, and I was so happy that this was our final exam because it really allowed me to research more into this topic that I was really interested about. And thank you for watching this video, and I hope you have a great day. Thank you!